experience with me. I think what makes this case particularly striking is that unlike facial PLA, where we have decades of safety efficacy data, there's no reports that I was able to find of vaginal PLLA injections, and so no, of course, standardized dosing protocols, safety studies, and guidelines. And I think, just more broadly speaking, even outside of vaginal rejuvenation, how do you think practitioners should be approaching procedures where patient demand is clearly outpacing the safety and efficacy data?
I think, that it's a great question. I think we have to thread that area very, gently. I think you have to stick with, your gut and your basics. And there are certain things that might not necessarily be, approved for that particular indication, but based on our knowledge of, anatomy and physiology and science and mechanisms of uh, you know either energy devices or procedures that we're doing. There are certain things that maybe are novel but make sense and are safe, and there are things that have a lot of unanswered questions and very limited data. And personally, I'm a little conservative and like to see a little bit of, safety data before I incorporate something completely novel into my practice.
What I would